welcome to Menopause Rescue. I'm Dr. Polly Watson. Midlife women are often caught up in a sea of symptoms. Too often, they're overwhelmed by the lack of support from mainstream healthcare. They're inundated with so-called experts who are selling solutions which may lack credibility. I'm a Menopause Society certified gynecologist with both traditional and functional medicine training. I'm here to guide you through this transition and help you decipher the facts from the fads. Armed with credible information, I hope you are empowered to rescue and restore your health, making the second half of your life your best. I am excited to be with Heather Boykin, who is a palliative nurse care practitioner. Heather holds a doctorate in nursing practice from UNC Chapel Hill. She's a board certified adult nurse practitioner. She's worked in academic medicine and also in clinical medicine. Currently, she serves as clinical manager for an outpatient palliative care at a prominent not-for-profit organization in northeastern North Carolina. She remains a practicing clinician as well, caring for people living with cancer, heart failure, kidney disease, dementia, and other serious illnesses. Heather is passionately dedicated to helping people living with serious illness and their families to navigate their healthcare journey in ways that align with her goals of quality of life, dignity, peace, and respect. So thanks so much, Heather, for being with us. Maybe you can start off a little bit by talking about what is palliative care. I think this is a really important topic for menopausal people because we are at this sandwich generation where we have all of our own health journey while we're also managing a lot of complicated health issues with our parents.
Yeah, absolutely. Thank you for that introduction, and thank you to you and your listeners for having me today. To get to your very important question, what is palliative care? That's a big one in the community and lots of misunderstanding about palliative care. So I'm happy to speak directly to that. The important thing to know about palliative care is that it is a specialized type of medicine aimed at improving, protecting, and preserving quality of life for people that are navigating serious or life-limiting illnesses. So to say it a little differently, we focus on providing comprehensive support and relief from the symptoms and stressors associated with illness, overall with the goal to improve and preserve quality of life. And as you mentioned, palliative care is important now for this discussion as we think about our own health journeys and that trajectory, and also as we engage actively in helping our parents who are aging, navigating this phase of life, these final chapters in a way that's dignified, planned out, and organized.
Sometimes we're not starting these conversations as early as we would like to have, right? And maybe if our parents haven't let us have this conversation earlier, we have an opportunity now at midlife to be really deliberate about talking to our kids about what we would like the end of our life to look. And so this is so important because sometimes we are in the midst of a really challenging situation where we think, gosh, man, if we had this conversation 10 years ago, that would have been great. And maybe we can reframe some of this as even if we didn't have the forethought to have the conversation earlier for the people we're working with now, how can we do it differently for ourselves?
Yeah, absolutely. These are important conversations. A lot of people think about advanced care planning as being purely document preparation, but that's only one part of it. It is really reflecting on, as we ourselves get along in this journey of life, what's important to us about our medical care, having reflection on that, dedicated reflection on that, sharing what's important about our preferences, sharing that with family, sharing that with our doctors and our medical teams, writing it and then sharing it again is important. That's important for us. And that's important for us to be curious about those preferences for our aging parents and family, approaching conversations with empathy and curiosity, and finding a time to really say, let's sit down and talk about this. There are pieces and parts and aspects to your life that I want to learn more about. Let's set a date for that.
So we've talked a little bit about advanced care planning. This isn't just preparing a document. We're setting aside some time to be really intentional. I think one of the things that comes up for me as a physician, I'm not sure sometimes doctors do a very good job about explaining to family members what's involved with some of these end of life procedures, right? So, how can we help people advocate for their loved ones when they're thinking about you have someone, let's say someone has ovarian cancer and they're at the end of their life and they're asking about putting a chest tube in, and the chest tube might relieve some fluid and that might provide this person some comfort, but it's also going to cause them some pain. If the chest tube is going to keep filling up and filling up and filling up with fluid, do we stop after the third chest tube? Do we stop after the fourth chest tube? Like, if you've never put in a chest tube and you don't really understand that procedure, how can you advocate better for your loved one, right? So I guess maybe when we're thinking about advanced care planning and we're thinking about what do I want at the end of my life, how can we also put some things in there about perhaps painful interventions? When do I stop doing painful interventions? So can you kind of talk us through maybe how we would shape that conversation, or how do we ask better questions of healthcare staff? I think oftentimes people are using all this war-like language around the end of life. I'm a fighter, I'm a warrior. And I think there's a lot of um, I want to be Switzerland, man. I want to say, when it's my time, I've done been had. Let's lay it down, sword and shield. Let's go. Right? And if I don't have good quality of life, then so like, how can we ask better questions? Like when you're working with a family, how do you kind of help people understand? Okay, if we're going to do this intervention or choose not to do this intervention, what kind of questions should people be asking?
Yeah, you bring up so much that's important. So lots of things to speak to there. Number one, you bring up the intensity of medical care in the context of a really life impacting diagnosis. So if I can back up and say the most important thing in terms of timing is for, first of all, any of us to begin thinking about this now while we're well. What's
Mhm.
important to me if I were to be diagnosed with a life impacting illness? I need to be able to reflect on what I would wish to endure. So all of us preparing now while we are well. Now, there's also another time point that's really critical is like you speak to. Let's say I've been diagnosed unfortunately with a gynecologic cancer. That means I'm going to face some challenging decisions as we go along, and I don't know what that road looks like. It's also another juncture to reflect back on preferences, because the things that might have been important to me when I did my advanced care planning without that diagnosis may look different than they do now. So it
Mhm.
is being able to engage with your providers as a patient, saying, doctor, healthcare provider, these are some of the important things I'm thinking through. I have a lot of questions about my diagnosis and how it's going to impact my life. um, I want to pause and talk about quality. I want you to help me navigate what could be very serious about this journey so I can have some thought about, does that align with my goals for what a quality of life would be? So this conversation evolves. It starts now and it evolves over time. It's nothing that we have once and we pack it away. It evolves, it revives, dependent upon what we are experiencing in our health journey, if that makes sense.
Yeah, I love that. And I also think it speaks to the point of the sooner and more often we can bring these things up, we can normalize the conversation. Absolutely. I just think that the more we pull this out of the closet, because having these conversations at the 11th hour, it's really hard to have a high quality conversation, I think.
Absolutely. And so, for that reason, I would say let's not wait until our doctors are telling us that you've got a serious illness and we may need these very intensive medical procedures to prolong your life. Let's begin thinking about our last journeys of life now so that we're in tune with that conversation, that we carry that with us as we travel, through our journeys, and that we revive that conversation based on our health journeys. So to kind of answer the second part of your question, when a patient and their family are sitting with me with the honor of getting to know about them and their journey, they're often faced with those critical decisions. So we talk about, besides the intervention itself, what means quality of life for you? That's my big question. Help me get to know you. What is quality of life? What makes life worth living? What feels good? What are your non-negotiables that if I ever had to be in this state, it would not be consistent with the quality of life I would want to live? I love to garden. I want to think for myself for as long as possible. I want to remain in my home. I don't want to be tethered to pumps and machines. So those types of things, when we think broadly but deeply about quality of life, can really help us then focus in on the important questions when the doctors say, you may need a chest tube, you may need an intensive intervention that changes how you look and feel. So we've already started some of that conversation well ahead of need.
And I love the way you frame that about what are your non-negotiables, right? Because it takes a moment in someone's healthcare journey when they may feel powerless, and you just gave them a ton of power back. And I think that's another thing to keep bringing up is that sometimes people in healthcare settings feel like they are subject to, right? They are being operated on. They're very passively being acted on. They are being medicated or whatever, and they're not in a place where they're actively advocating for themselves. And so you've flipped the narrative so beautifully there, where you said, okay, hey, here we are in this moment. It's an honor to be able to be with you in this moment in your life. Let's reflect, and what are your non-negotiables? What does it mean to be alive for you? And we're going to help you preserve that. So it gives the patient so much more power, and their family so much more power, right?
Absolutely. There's lots of layers here. There's incredible benefit for the person on the health journey to make time to reflect, to figure out what really means quality of life to you, for then their family members, their potential healthcare decision makers to hear those important words, because that certainly will relieve burdens down the road if we become ill, if our parents become ill, and we've had some pre-planning, some conversation to understand what's important. Most people think that this conversation is really important. Half of people have it, and even less people than that actually take it further and make it formal. So we've got great opportunities to really make sure that why we are taking care of people in life, that we're also helping them attend to the last phases of life and even the end of life. That's part of our care as palliative care doctors, as gyne, OBGYN doctors, as anyone. That's part of our service.
Yeah, I think it's really important. So many people may be listening and think, holy crap, like I don't even know where to begin. This sounds really scary. It sounds kind of morbid. You want me to normalize something that I feel really uncomfortable about. So maybe you can kind of give people some hints on how to start the conversation.
Yeah. I think it is expressing your interest. So let's for the purpose of our conversation, hypothesize that we're trying to think creatively about how we want to reach out to our parents to have this conversation. And I think you have your script, you know them the best, but expressing that there are things about you, mom, dad, that I don't know, really important things that as I continue to love you in this life and follow you and help you, I need some more information about what's important to you. Can we talk about that? These are some of the questions that I have as your daughter or your son, your loved one, that would help me understand more about you. Um, and, just opening up curiosity, empathy, and sensitivity for it. It can be also as simple as saying, today's your 85th birthday, or it's coming up. Can we, besides celebrating, also do a little bit of work in terms of planning? So it's making a date for it, whether it's National Healthcare Decision Day in April, whether it's a birthday or some kind of milestone, where you say, let this be part of our gathering today, to just start that conversation as a family. And I fully acknowledge there's a lot of challenge there. It feels very huge, like you said, can feel morbid, uncertain. So you also know that you've got really great healthcare providers, likely a part of your team, that can help you also begin the conversation. So healthcare providers can help carve out time to say, besides the things that we're seeing you for, attending to primary care needs, let's carve out some time for some advanced care planning. Let me help you start the conversation. And that's another way to kind of approach it, is leaning on your healthcare providers.
I would say probably making a specific time. I think it would be probably unrealistic to think you're going to get your GYN exam and they've got 12 minutes and, make a separate appointment for that. My mom just had surgery at 76, and it was really interesting because the anesthesiologist looked at me and said, "Is she a full code?" And mom looked at me like, "What are you talking about?" I thought, wow, we didn't go into the surgery making sure we had all of our T's crossed and our I's dotted, right? And that would have been a really pivotal moment to start the conversation and say, hey, sometimes things really unexpected happen in surgery. If you needed someone to put you on a breathing machine, would you want them to do that? And my mom is otherwise fairly healthy, so she was in full code, and that was pretty straightforward decision for us at this point. But it really highlighted to me we hadn't had the kind of conversations we could. And then, even though I think the surgical center and the hospital was trying to do a good job, they said, "Do you have an advanced care directive? Here's a pile of paper." I think that ends up on the kitchen counter in the junk drawer, right? And so, kind of me asking for permission to have these conversations. I love your framing of, I don't know as much about you. I want to keep learning about you. It's such an act of love. I love the idea that these conversations can help give some power back when it feels like power is being lost. So maybe you could talk through us a little bit more about when you're having conversations with people about what does it mean for them to be alive? What are some of those things you're thinking of? Like you mentioned living in your own home or being in the garden, but like what are those things when someone's really struggling to put words to this and you're going to kind of give them a grocery list? What would you bring up?
I like to hear. I like to kind of start, if that question is hard, is, if the question of what makes life worth living for you is hard. It's a huge question, and you're on the spot to answer a very deep question. So then you kind of back up and say, tell me about your day to day. What brings you joy in those days? What kind of things do you like to do? What do you look forward to in a day? And a lot of times people can say, gosh, I love spending the morning on the porch with my coffee. If I couldn't do that, it sounds like a small thing, but if I couldn't do that, I think I'd be really unhappy. Or, whatever it may be, being in the garden, people that maybe have physical limitations already say, if I can simply get my walker and get out to the mailbox every day, that's a win. If that changes, then my quality of life probably isn't measuring up. So, kind of in the context of how that person is currently doing, we get to explore that day to day and the little pieces that make it meaningful. And that often sheds light on the big picture quality of life, perspective, and preferences. I hope that answers your question, which is a really thoughtful one.
Yeah, and I think the other thing I'd like to sort of maybe bring up is clarifying for people, because I think sometimes people think about hospice care or end of life care as giving up. I would love to flip that for people because I feel like not continuing to subject people to painful interventions that may have a very low likelihood of prolonging life and diminish life quality, choosing not to do those things to me sounds like a real affirmation of life. So, how can you help oftentimes you're probably doing a lot of family management, right? You might have a brother and a sister who think really differently about mom's care. So can you kind of talk about how do you flip this hospice as a positive choice narrative for folks?
It really comes down to defining hope and what hope looks like now. Um, our idea of hope may have looked a lot different before we arrived to our eighth decade of life, before we were faced with a heart failure diagnosis. Hope looked a lot different, and the things we were willing to endure then looked a lot different. But as we get older and our journey unfolds and potentially gets more complicated, especially in the setting of serious illness, hope looks different, necessarily so. So, when the tools that we have in medicine to try to fight for, what hope used to look like, when they've lost that benefit or they've unfortunately become a threat to our quality of life, embracing other ways to care for us when we're sick, redefining hope, means that things like hospice or end of life care can become an important tool. So it is not a giving up, but it is letting some things fall away, some intensive medical things like you described before fall away, and instead we replace them with what serves us now in this new hope. It is the hope for comfort, for dignity, to be liberated and protected from things that threaten our quality of life or potentially shorten our life even more now that we're sicker or older. So it's really a shift in focus. It's embracing, the tools, the support that's helpful to us as we've aged, as we have more complicated health. And I think, hospice is a way to do that. If that is something that someone is determined, I want to focus on comfort and peace exclusively, and how can you take care of me? Hospice can be part of that plan, part of your team.
So you talk about some really important resources. So maybe you can kind of help people know they looking for a resource online. Where can people begin?
Right. Where do we start? There's lots of great things, small and big projects. If you want to say, you've talked about a lot today. I really kind of need a roadmap. So one of the great places to start is the Conversation Project. So you can Google the Conversation Projects and it comes up. You'll see a lot about National Healthcare Decision Day, which is typically April 16th every year. And it really focuses you on advanced care planning for health planning. So, it circles back to what we've talked about today, how to begin the conversation and when, navigating through some of those challenges. And then as we've thought about our preferences, talked about them, how do we write them, and then how do we share them again? So it helps you walk that journey, and then also make some of those things formal so that you can simply hand some of that to your family, that you can have that documented, share it with your healthcare team, and it serves as a document that honors you through your journey. So the Conversation Project is the big one. Also, begintheconversation.org, and certainly we can make sure these links are available to you in the podcast. Begintheconversation.org is another really great one, and it's the same type of roadmap, but you may find that one fits you better than the other. So those are great places to start, and I would leave that kind of simple. There's many other things you could kind of dig into. And then in terms of palliative care, I've heard, you may be listening thinking, I've heard this term again and again. We've talked about so much today. I need a reminder about what is that palliative care thing you mentioned today. So in terms of another resource, getpalliativecare.org is also a place that helps guide you in terms of, I think that might be an interesting place of support for me. I also want help with some of this advanced care planning or talking about how my illness might impact my journey. Maybe I need some palliative care folks to help me really focus on that. So getpalliativecare.org is another great place to start.
And I think it's important maybe just to normalize this again. Let's say I got a pretty significant GYN cancer, like ovarian cancer, and let's say you were taking care of me and it was not good news. I, as a patient, could meet with you, right? Before I decided to go into palliative care, this could be another consultant that I could meet with and information gathering when I was trying to decide what to do. And I think sometimes people are in the mindset that this is the last ditch thing. It's not, we could involve palliative care experts while we're trying to decide what and how much treatment we want, correct?
Yes. So palliative care is a partner in your care. It doesn't change anything about your care. It's not something that you enter into and all of your other doctors or teams go away. So palliative care is a partner with you on the journey. And if you have received some news that is going to impact your life, it is always a good time, the earlier the better, to say, you know what, I need that special person on this journey to help me sort through what this means and help also me navigate some of the decisions that I may be faced with. And also, the one thing we haven't mentioned today as well is palliative care is also focused on helping to attend to and maybe even relieve some of the symptoms that you may have as a result of a cancer, heart failure. So we are also clinically focused in that way to partner with your teams to make sure, beyond the emotional, spiritual pieces to your journey, that we're keeping your body comfortable, that if you're having treatments and we can help with the symptoms or the pain, we're there to partner on that as well. So we are there to join you in your goals and your focus, whatever that may be.
This is just so fantastic. I love your approach. I love the language you're using. We don't talk about honor and respect and dignity enough in medicine. We're often focused, we were trained in a disease focused model, and you're really listening to, you are a human focused model, and it is just so beautiful to see. So I'm so grateful for you and sharing this time with us and all of the great work that you do, because it's really great to meet someone in healthcare who's so focused on people's whole person.
I appreciate that. And I can speak for anyone in palliative care that it's an honor to do this work, to be allowed to get to know people at deeper levels and to be a partner with them on their health journeys, whatever that looks like. So it's been an honor to meet with you today and to share more about this. I hope the resources attached will be helpful. And of course, there's people like us out there to make sure, no matter what your health journey looks like, you've got a partner to make sure that the human being on the journey is not missed.
Thanks for listening to Menopause Rescue. We hope you've enjoyed this podcast and it helps you create some time and space to make this the best half of your life. If you've enjoyed this content, please leave us a 5-star rating and review. This helps other listeners find this resource and rescue and restore their health. If you enjoyed this topic and want to learn more, check out our resource guide for this episode. If today's podcast resonated with you and you want to take a deeper dive, check out my educational resources. We offer basic membership, which is an archive of over 100 videos on menopausal topics ranging from bone health to libido. We add to this archive every month, so the resource becomes richer and richer over time. If you're looking for a menopause expert and live in North Carolina, take our free online class and see if we're a match for your needs. It's called Are We a Good Fit? And is a quick and easy way to learn more about our practice and what it has to offer. Hey, this is Dr. Watson. This is just a friendly reminder that this podcast is for general information purposes only. and does not constitute the practice of medicine. No doctor-patient relationship is formed, and any information you get from this podcast is considered educational only. You should make medical decisions with your healthcare provider. The content of this podcast is not intended to be a substitute for professional medical advice. Listeners should not disregard or delay in obtaining medical advice for any medical condition, and they should seek assistance from their healthcare professionals.